guys, here we are, another Friday Q&A with Dr. Dre, where I answer your skincare related questions as they come through on the vlogs throughout the week. If you're new here, welcome. My name is Andrea. I'm a dermatologist. I post day in the life of a dermatologist vlogs, and these Friday Q&A videos have become kind of a mainstay here, in which I address skincare related questions that come through in the comments section of my vlogs and other skincare related videos that I post. So I encourage you, if you're new, to give this video a thumbs up if you like it and subscribe for more. With that, let's get started because we have yet again a lot of fantastic questions this week. Alright, so you all know that benzoyl peroxide is a skincare ingredient favorite of mine. I even have a video on it, which I'll link down below, as to why I like it, particularly for people with acne. I've been getting a fair number of questions regarding if benzoyl peroxide is damaging to the skin, causes free radicals that could potentially age the skin. While some of benzoyl peroxide's mechanism of action against bacteria involve oxidation, the data regarding free radical generation in skin is just not there. And there is no evidence that it promotes skin aging or accelerates the cutaneous signs of aging. I will also point out that not only is benzoyl peroxide antimicrobial, but it's also very, very anti-inflammatory, and actually has been shown to decrease the number of free radicals generated in inflammatory skin by virtue of inhibiting the white blood cells that release free radicals. We just don't have the data to suggest that benzoyl peroxide accelerates skin aging or is of any concern. So the next question is with regards to chemical sunscreens and chemical sunscreen ingredients being absorbed, and is that something to worry about? So the chemical sunscreen ingredient oxybenzone has been shown to be systemically absorbed, and so there are some controversies and concerns that this ingredient may be dangerous to us, and there have been many studies in the medical literature looking at this as a potential endocrine disruptor in people. There's no consistent and confirmatory data that using chemical sunscreens with this ingredient causes any significant endocrine abnormality or is associated with any disease. So yes, this ingredient can be absorbed systemically. However, we have no evidence that it is harmful to humans. The next question that I got is with regards to something called a seborrheic keratosis. It is a benign skin growth similar to a wart, but not caused by a virus. And it is not dangerous, and removing these does not protect you from getting more of them. There is no cream to get rid of them. The reason why people develop them is something that we really do not know. If we could figure it out and come up with a cream to just get rid of them, I think many people such as yourself would be incredibly happy. But currently we don't have a cream to just get rid of them. There are some procedures that can take them off. There is a chance that they will come back, and the procedures that take them off do not prevent you from getting more of them. There is some thought that individuals with pre-diabetes or early diabetes may be more predisposed to developing these, but that being said, having these does not mean that you have diabetes. So the next question that I got is a fantastic one, and it's with regards to something that's quite common here in the United States, which is poison ivy dermatitis. This can occur any time of the year. It's not just a summertime rash. It occurs as a result of exposure to poison ivy or poison oak, which contains something called urushiol, which is an oleoresin that in sensitized individuals results in what's called an allergic contact dermatitis that results in the characteristic itchy, blistery, weepy rash of poison ivy. Not everybody who is exposed to the plant will develop the rash. It requires that you have been previously exposed to it and developed a sensitivity to it. And so if you have a sensitivity to the plant and are going to develop a rash, you will most likely develop the rash within the first 12 to 48 hours after exposure to the plant. However, you can continue to develop new areas of rash long after that as a result of either spread of the oleoresin to different parts of your body or just sort of a delayed eruption of the rash. The best way to prevent it is to avoid it. In the summertime, for example, we know the adage, leaves of three, leave them be. However, in the wintertime, the plant grows as a vine with little tendrils and can make berries. And then in the fall, the leaves can actually turn bright, vivid oranges and yellows. Now, if you are exposed to the plant, the allergen penetrates the skin usually within 10 minutes. So as soon as you are exposed, it is best to wash the exposed area with copious amounts of water within 20 minutes of exposure, ideally. I will stress wash with copious amounts of water only, not soap, not any kind of lotion or oil. The reason being that soap and lotions and oils actually increase the distribution of where the allergen is on your body and will just make you have more rash in other areas of your body. The other thing to be aware of is that our pets, cats and dogs, can brush up against these plants and carry the oils on their furs. Also, your clothing can carry the oils. Be sure and wash your clothing immediately in water. And as I said, avoid the use of soap after becoming exposed, as it will increase the sort of distribution of the allergen. I've been getting a lot of questions about dapsone gel. So dapsone, the pill, is an antibiotic. Furthermore, dapsone is also anti-inflammatory and inhibits some of the white blood cells in our from moving into our skin. Dapsone 5% gel applied twice a day is FDA approved in the United States for acne, and it can be effective. For reasons that are poorly understood, it tends to be effective mostly in adult women with adult acne, less so in teenagers and men. If you are prescribed this, you should know that if you mix it with your benzoyl peroxide, it will stain your skin orangey yellow. That is not permanent and can generally be removed with a washcloth. Somebody also asked, is there any worry about bacterial resistance with this? To date, there is no data demonstrating bacterial resistance to topical dapsone gel, or the brand name is Axone. So a follow-up to that is, I got a question about the use of systemic antibiotics for acne, namely doxycycline or minocycline. So the tetracycline family of antibiotics particularly, which include things like doxycycline and minocycline, as well as a variety of other antibiotics, are commonly used not only in treating the inflammatory lesions of acne, but also many other dermatologic diseases, specifically rosacea can also be helped significantly by courses of antibiotics. And the mechanism is more so geared towards the anti-inflammatory effects of these medications rather than their antimicrobial effects, is the concern for bacterial resistance. So our goal is usually to use these medications to help calm down the inflammation that could potentially lead to scarring and disfigurement. So the goal usually with an oral antibiotic is to keep you on it for no more than 3 months. That being said, some people are on these medications for more than that. And it's the longer that you're on them, the greater the risk. So yes, it is always something on the forefront of our mind, but these medications continue to be incredibly effective in our armamentarium of treatment for not only acne, but a variety of other inflammatory skin diseases. Someone also asked, what about depilatory creams? Are they good? So depilatory creams, like things like Nair, for example, contain sulfides, thioglycolates, and enzymes, either alone or in combination with one another, which function to dissolve keratin. So they basically just dissolve the hair. They are a good option you may not need to shave as frequently. That's because they kind of get down into the hair follicle and dissolve the hair a little bit deeper than where your razor blade might be able to cut. However, the problem with these products, unfortunately, that you may have experienced if you have used them, is that they don't distinguish, is that they work to dissolve the keratin structure in the hair shaft. And in doing so, they're not so great at distinguishing the hair shaft from your skin. And so you can often get quite a bit of irritation as a result. They're not very good when applied to the face. The instructions may vary with the product, so be sure and follow the instructions to minimize the chances of you developing a really bad irritant type rash. So I also got a question about my thoughts on dermaplaning, and I get this a fair amount. So dermaplaning is something that was first described in the 70s actually, as possibly a treatment for acne. The procedure can be performed in one of two ways, either taking a scalpel blade and dragging it across the skin, or using what's called a microtome device. However, since the first description of dermaplaning 3 decades ago, there has been little to no published data on the efficacy of this in treatment of acne and or anti-aging benefit. However, it's a procedure that continues to be offered in cosmetic practices and by estheticians. But the data for its efficacy and utility in treating skin diseases or skin benefit is completely lacking. I get a fair number of questions about should we be concerned about alcohols in our skincare products. To a certain extent, yes. Alcohol and alcohol-based toners and astringents can be incredibly harsh. It does dry out the skin, and those products should be avoided, particularly if you have rosacea, as these will be highly irritating to you. Alcohol and skincare products in general is not something to make a blanket statement about avoiding. And the reason is that sometimes some alcohol in a skincare product may be necessary for the stability of the active ingredient. All right, and the last question comes from Derek Wayne, who's been so patient and has asked this before and I didn't get a chance to it. And it's for me to address the ingredient azelaic acid in both acne and I believe discoloration and skin disease. So azelaic acid is an ingredient found in the prescription Finacea. It is a dicarboxylic acid that yeasts that naturally live on our skin and can contribute to dandruff in something called tinea versicolor actually make these dicarboxylic acids themselves. So we started studying them, and turns out they're anti-inflammatory. They can help break down clogged up pores, and so they're very helpful in acne. It is so safe that it is actually fine to use in pregnancy. So its anti-inflammatory component and its ability to help kind of break down some of the plugged up pores make it a good ingredient for acne. It's also an excellent ingredient in rosacea, probably because of its anti-inflammatory property. And it's also a good ingredient in discoloration of the skin and dark spots, melasma, because the dicarboxylic acid actually can inhibit some of the enzymes that are important in making the skin color and help lighten things. It's not the best we've got, and it tends to be very expensive. So, yeah, it's a good ingredient. It's not, you know, like super robust as far as its effect on anything, but it can do a variety of things. I wish it were more readily available. And, you know, it's sold over the counter in a variety of cosmeceutical things. They're not regulated in the same way. So once again, we got a ton of great questions. This is something that I enjoy doing and I hope is helpful to you guys. So if you have a question that you'd like me to address, the best place for me to see it in a uniform manner is in the comment section of this video. So I hope you enjoyed it. Give this video a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys in my next Q&A. Bye!